Uganda has so far registered more than 450 cases of community transmission as of today. Now, according to the Ministry of Health, community transmission is when one contracts a COVID-19 from within their surrounding, for example, from a neighbor. Some of these are still a mystery to the Ministry of Health. Now, Walter Mwesije has put together a countrywide representation of this. So over to you, Walter.
Thank you very much, Flavia. Now, what you see on this map here is a distribution of locally transmitted cases by district of sample collection or according to samples collected from various districts as of 2nd August. The green shade you see here is the representation for districts where no community transmission have been recorded. This, one would say, is a good thing. However, the Ministry of Health says there is a steady increase in the number of community transmissions. And the white patches you see is a representation of a total of 22 districts that have so far recorded up to 1 to 4 cases in those districts. And the next shade, which looks like pink, are those that have had between 5 to 12 cases of community transmission. And according to this map, these total up to 10 districts. We have those in a lighter shade of red, including Boikwe and Kampala, which have recorded up to 43 cases as of 2nd August. And lastly is the deep red that you see with some ripple effects here. Those are the districts that you would call hotspots for COVID-19 infection, and those include Tororo and Amuru district, which have recorded 53 and 111 cases consecutively. It should be noted that the 3 districts, including Kalangala and Boikwe, are considered border districts because they are access points from both Kenya and Tanzania via Lake Victoria, and Chotera, Busia and Amuru border Tanzania and Kenya and South Sudan respectively, which have largely been the access points for truck drivers. And if you have been following the COVID-19 trend in the country, you know that many of our cases have been foreign, especially of truck drivers. According to the Health Minister's national update of 30th July, Uganda has had 2,224 tests positive for COVID-19, 1,715 of these being foreign truck drivers. As of today, we have 5 deaths of COVID-19, the recent one being an Indian who succumbed to the disease on the 1st of August, as reported in today's update from the Ministry of Health. However, one thing to note is that the results of the dead have been announced at least more than 24 hours after the death of the victims. The worry from the Ministry of Health is complacency from the public. But it is important that we follow guidelines from the Ministry of Health in order to prevent contracting and transmitting the disease. Stay safe. Back to you, Flavia.